Overall, there are a lot of rare diseases. It's been estimated at more than 10,000. So when you add all of those up, it is a big problem. It often takes 7 years or more for patients to get a diagnosis for their disease after symptoms appear because they are so rare.
There's so much that we don't understand. Many of these rare diseases, people don't know how to spell it. They don't know what it means.
When my son was diagnosed with Duchenne 11 years ago, I had never even heard of the word. The healthcare system needs to understand what a stressful and frustrating thing that there is no treatment. Well, why? Why is there no treatment?
At the moment, patients with rare diseases are treated with generic immunosuppressant therapies or high-dose steroids. We know they don't work very well, and many of the processes that have been developed globally don't give a lot of weight to the perspective of patients, and they don't get to the root cause of the rare disease. Getting external stakeholders to consider and listen to the voice of caregivers in addition to patients requires so much work to be done. It is too much for a single entity.
The burden of people living with rare disease, I don't know that we fully understand, which is why research and work is so important. What makes it so difficult is trying to find the balance of what are those commonalities across some of these rare diseases and how can we quantify that for a physician or a payer or a government official or anyone really who's trying to advocate for better access, better treatment for someone living with a rare disease.
A lot of times we have to become our own experts, right? Because these are diseases before we receive the diagnosis we had never heard of before. We need to make sure that we're capturing the lived experience of the caregivers, and we're doing so in a systematic way. Look at us as partners.
So partnerships with organizations like IVI are critical to really make an impact, to help drive the agenda.
We're very good at convening different stakeholders, patients, families, healthcare providers, policymakers, and manufacturers. You realize that these people rarely get together and share what are they working on. And so we pride ourselves on being able to bring those people together.
I think with certain stakeholders, you have to learn to speak their language. They want their decisions to be evidence-based, and so do we. But how are you to understand what a number on a chart means if you don't live with this disease every day?
Patients tell us a lot of times they feel like they're brought into these processes to check off a box. And so we wanted to make sure that this was authentic and that we were hearing from multiple perspectives.
You really have to find a way to create that mutual respect, trust, because oftentimes you're meeting people at their most vulnerable, at their scariest moment, whether they're living with the disease or they're caring for someone with it. You listen to them, you develop relationships, and you make sure that what you're doing is actually going to meet some need that they have.
For this project, we want to start with the patient and have the patients involved throughout. We set up a multi-stakeholder steering committee. We also had multiple roundtables where prioritizing transparency and patient-centric outcomes. That can help us to design better studies and hopefully improve lives as we go forward.
For GMG 360, people spend their free time helping us shape the study, interpret the findings, work on the publications, because they saw the urgency. If this is not inspiring and makes you go to work, I don't know what is, but it certainly sets me on fire.
Even if I look back, the evolution in that community has been incredible. There's a lot of momentum, and I think it just gives me a lot of hope for everything's to come.
It's important that we all work together and create a landscape where caregivers are valued as partners and they're empowered. This will lead to better outcomes for everyone.